Psychodynamic therapy is an insight-oriented therapy which focuses on dynamic, unconscious processes that affect our emotional quality of life. The basic goal of psychodynamic psychotherapy is to help people with problems and patterns that lead to unhappiness and dissatisfaction in life by uncovering unconscious thoughts and feelings and/or directly supporting function in the context of the relationship with the therapist. Unconscious thoughts and feelings, though not apparent to a person, can ultimately dictate how they respond to people and the environment. Bringing these thoughts and feelings to consciousness is the work of psychodynamic therapy. All practice models are developed from a foundational understanding of human behavior, drawn from one or more explanatory theories. Psychodynamic therapies originated from the four major schools of psychoanalytic theory: Freudian, ego psychology, object relations, and self-psychology. Freudian theory, also known as drive theory or structural theory, was developed by neurologist Sigmund Freud in the early 20th century and focused on the drives of the unconscious, id, that at times are modulated by the ego or superego. Freud's daughter, Anna Freud, later further developed the theoretical lens to include defense mechanisms which serve to protect the ego by minimizing psychic pain. From Freudian theory, the other major schools of psychoanalytic theory developed. Ego psychology focused on improving and maintaining ego functioning. Object relations focused on the internalized representations of the self and others that were developed through early life relationships and experiences. Self-psychology focused on the sense of self and the differentiation or lack of differentiation from others. Psychodynamic therapy recognizes that relationships and circumstances of early life continue to affect people as adults. These early experiences develop unconscious and conscious motives for behavior. Talking about these relationships and experiences can bring these motivations to the conscious. From these insights, change may take place. Psychodynamic therapy focuses on helping clients improve functioning in 5 domains: self, relationships, adapting, cognition, work and play. These areas of functioning, previously conceptualized as ego functioning, include our reality testing, impulse control, and self-esteem regulation. Clients are encouraged to speak freely about whatever comes to mind. This may include current life events and problems, wishes, dreams, past experiences, and relationships. Clinicians spend ample time actively listening and observing, while paying attention to the process and content of what is being shared. Reflective statements and clarifying questions are utilized by the clinician, both for clarification purposes and to help clients develop insight. Sparingly, clinicians point out repetitive behaviors, confrontation, and provide imperative statements that put behaviors in context. While it may be said that the therapeutic alliance, the strength of the relationship between client and clinician, is important in all clinical practice models, it is most central in psychodynamic therapy. The ways the client thinks, feels, and behaves towards the clinician, transference, as well as the way the clinician thinks, feels, and behaves towards the client, countertransference, are a central focus of the therapy and therapeutic process. Psychodynamic therapy may be practiced without a projected timeline of length of treatment or may be time-limited, as in the case with brief psychodynamic therapy or pragmatic psychodynamic psychotherapy. Research literature supports that psychodynamic therapy is beneficial for individuals who experience depression, anxiety, eating disorders, and problems related to somatic pain symptoms. Critics of psychodynamic therapy identify concern with the subjectivity of the effectiveness and limited efficacy research compared to other models of practice, such as cognitive behavioral therapy. Critics also often focus on the limitations of its applicability across cultures, which remains an important point of concern with most clinical research.